this is now being recorded. What we'll ask just with some housekeeping, if you can all please try and keep your mics off. So if you're not a speaker, it's helpful if you can also keep your camera off. It keeps the Teams flowing better, and also then people can see who the speakers are. So I'm just going to share with you again the agenda for those of you that have just come into the room. So there's the agenda, and say just welcome really from myself, Annette Farrell. Next, Neil's going to give you an overview of the healthcare support worker role. And then we've got healthcare support worker Sarah, who's going to give us a brief of what her role is like as a support worker in an acute hospital. We've then got a very short video. And then we've got Effie, who's also a support worker but works in a mental health trust, who's going to tell us about what her working day is like and why she likes the career. And then we're really pleased to have with us from Frimley, Catherine Bailey and Nicola Morgan, who are going to talk more about the role as a career and also apprenticeship opportunities. And then we've got another video for you, and Neil will do a summary, and then at the end I've got some trust contacts for you if any of you are interested in looking at contacting any of the trusts in your local area. Well, we are doing the webinar. If you want to post any questions, then if you know how to do the chat, then do please post questions in the chat. Neil and I will be looking at those and picking out a few questions each time for each of those speakers, so that we can get some of the questions to them. Obviously, we probably won't be able to answer all questions because we've only got an hour, but we'll do our best to pick some out for you. So I'm now going to hand over to Neil. Thank you.
Thank you. Good evening, everyone. It's 6 o'clock, well, 6:05, and it's always that difficult time when everyone wants to have their dinner. So thank you for all that have joined. So my name's Neil Webb, Senior Lead Nurse for Frimley Health Foundation Trust. I'm not here directly recruiting for the trust. So everything I say is going to be represented for healthcare support workers. What an amazing job a healthcare support worker is. For some that are on the call that are thinking about their first step into healthcare, you will hear from our colleagues across the region around how wonderful this opportunity is. Be that in acute, be that in community, be that in mental health, be that in learning disabilities or maternity. This role interfaces with so many different professional people within both small organisations and large organisations, from care homes to the community, as I said, right across to midwifery at the most exciting point of a woman's life in having a baby. But also it incorporates those times at a sadder times, maybe the last days of life, where a care assistant will be with that individual who's seeing the last days of their life. So it really is a role that is wrapped around the most vulnerable times in people's lives. However, these roles are roles where we've had the permission to enter someone's life. Permission from either the patient or the relatives to really get involved in who that patient is, what their life was before needing healthcare, and really gives an opportunity for us to experience who that person is. So these roles give an amazing development opportunity. If you want to start off as a healthcare support worker and want to be the next chief nurse, many organisations will certainly support that, or that you actually want to stay being a healthcare support worker, and every organisation will develop you into the best person that you want to be as a professional. So my colleagues will tell you a little bit more about the role, but also about how we can develop you, how we can enhance who you want to be within the healthcare setting. So I'm not going to speak anymore, which is a first, and I'm going to hand over to Sarah, who's going to give a little bit more of a day in the life of a healthcare support worker role, as Sarah is one herself, but I'll hand over and let her introduce herself.
Hiya, my name is Sarah Sinclair and I work for Frimley NHS. At the moment, I work in high dependency as a HCA, and I've been there for about 3 years now. I've recently, last year, started my level 3 apprenticeship as well.
I think we got a slight technical issue there where we've lost Sarah, who was in full flow. Annette.
Back.
We're back. We're back.
We're back.
Right. I was having a really good go then. So, as I was saying, I do my level 3 apprenticeship at the moment, which is in adult nursing. So my role in
Oh dear, we've lost Sarah again. Okay. We'll just see if she comes back in, and if not, we'll Effie, are you there, Effie?
Yes, I'm here.
How do you feel about going next, Effie?
Yeah,
Well, Sarah sorts herself out. Is that okay?
Oh, you want me to go now?
If you're able to, and we'll get Sarah to sort herself out. So, are you able to put your camera on, Effie?
Okay then.
We're
Sarah,
having some technical difficulties over
Sarah,
here.
we're gonna let Effie go next.
Yeah,
Will you
that's
just
fine.
sort out so okay, so Effie, are you able to put yourself on camera?
Oh yeah. Is my camera not on?
You've put yourself on mute now, I think. Sorry about this, everybody. Always the joy of live webinars.
Can you see me? I've taken my
No, we
camera
can
on.
see a black patch.
Oh my God. Okay, sorry, I think it's closed.
Oh yeah, there you are. There we are. There you are. We'll do a bit of swift changing around, and we'll have Effie. So Effie works in Mental Health Trust. I'll let her introduce herself and go forward. We've lost you again there, Effie, or can other people see Effie? No, we're having a real good problems here with.
Yeah, I was removed.
There we are. Okay. Let's go, Effie.
Okay, yeah, my name is Effie. My full name is almost Effie Aronde. I joined, I started working with the NHS as an agency staff in 2020. I came in as an agency staff. I presently work with the home treatment team in Farnham Road Hospital in Guildford. Sorry. I started as an agency staff working across the wards, working age adults and older adults. And then sometime in same 2020, I joined the NHSP, the NHS professionals. And I worked with them, still working across the wards. And sometime around 2021, I started picking shifts with the home treatment team, which is slightly different from the working in the wards. It's what we do is we pay home visits to patients. We're kind of gatekeepers. We're between the wards and patients at home. So what we do is when patients, maybe like the bed management is struggling really, which is the case at the moment, and they feel like a patient can be managed at home, they refer them to the home treatment team. So we take over from there, and we monitor their medication, monitor their mental state and their risk while they are home. And if we feel like at any point they are relapsing, we refer them back for admission. And then if we feel like we've supported them enough, they're ready to move forward, we refer them to the community, which is the community mental health recovery team. So yeah, so I started picking shifts with them as an NHS professional in 2021, sometime 2021, I think. And same 2021, November, actually, I became a permanent staff with not the home treatment team, but I joined the 136 assessment suite. I don't know if people know about that. It's when the police section patients, it's the 136 assessment suite, they are brought in first. So we look after them, and where that is where the AMPs, the approved mental health professionals, comes to assess them and make decisions whether they have to go into hospital or they can be managed at home. They too refer to the home treatment team if they feel like this patient is needs support at home. They refer them to us and we take it up from there. So I took the permanent role in 136, which was in Abraham Cowley unit in Chelsea, which has now been transferred to, has been moved because Abraham Cowley was going to be rebuilt. So we moved from, I think I started in November, and in March the following year, which was 2022, last year, we were moved to Farnham Road Hospital. So we now have two 136 suites in Farnham Road instead of the one that was in Chelsea. So when we moved to Farnham Road in March 2022, in April, I think April somewhere, April 2022, I moved from 136 to home treatment team permanent, where I am at the moment. Yes, so that's my journey. And I came into the care sector, I think in 2029. First of all, I did a supported living. I never knew much about care, but when I did the supported living, I kind of like, I'm somebody passionate about seeing people being better, caring for people. And when I did that, that kind of like ignited my passion for the job. So that's how, and somehow I think it was there I got, someone gave me the link to the agency that brought me to Farnham Road. So that's my journey. So where I am now, I am about to start my apprenticeship in the nursing associate, and I hope to be a nurse in the future. That's the brief of me. If you have any questions.
Thank you, Effie. I've got one. What would you say is that you like the most about your job?
Okay. I am passionate about helping people, which is brought me into the care industry in the first place. But my role being in the home treatment team, I am somebody that likes, I like visiting people in their homes. And because sometimes I feel most of the patients I've worked with in the wards, they find it very difficult. I want to go home, even though when they know that they are not well enough, but they somehow it's not 100% comfortable for them. So seeing them, supporting them in their homes, seeing from when they were in crisis, really in a bad shape, and then becoming well again, that gives me a sense of fulfillment. So that's what I love about my job.
Thank you, Effie. And I can see someone's got their hand up. Is that Zoe still? It came up earlier as Zoe. Did you want to ask a question, Zoe, or put it in the chat?
I can't use the chat because for some reason it's been disabled.
That's all right. Fire away.
I think I had a bit of difficulties, but what qualifications do you need to go into the NHS?
To answer that,
Shall I take that, Effie? So at the moment, Zoe, there is some differences across different NHS trusts. So some of them will just ask for sort of general good level of education. Others will accept you without any formal qualifications. Some, unfortunately, still do ask for English and maths, and some trusts will accept a lower level of English and maths, but might get you to do a very simple assessment at your interview, just to make sure that you've got basic English and maths. So unfortunately at the moment it does vary, but you can look at your local trusts and see what it is they offer. What many trusts are doing now are taking new to care people, so people without any healthcare experience, and often at that point as well they won't ask for English and maths. And many of our trusts actually offer for you to do the functional skills once you start, so they'll support you to get your English and maths, which is really great as well. Nicola, did you want to come in?
I was just going to say I can pick up about qualifications when I talk about apprenticeships, if you like.
Okay, that would be great. Thank you. Thank you, Effie. That's really good and that's really helpful, because what we want to show you all today is that it's not just in hospitals. You can work in GP practices, hospitals, community, visiting people's homes, working with people, supporting their mental health, working with people that have learning disabilities. There's so many different roles that you can do as a support worker. I'll just take one more question and then we'd go to a very quick video and then we'll come back to Sarah. I can't see who's got their hand up. Oh, Manavi, sorry if I've said that incorrectly.
That's okay, and it's Manav. And again, I thank you for the opportunity. I'm in India right now.
Okay.
And my question is, somebody asked me to expand on what I wrote in the chat, which is the data point I have is only one, which is one vacancy I came across on Track Jobs. And it stated that I can, per my candidacy, which is I do not have formal education or experience, as in I haven't gotten paid for it, but through volunteerism, I have been serving an old age care home for past 3-4 years. So is trainee the only vacancy for me, or I can actually be an HCW worker?
Yeah, again, Nicola will pick that up a bit later with some more career development information.
Sure.
But yeah, absolutely. Many of the trusts now are taking you to care, and you can apply straight into a support worker role. And when I say healthcare support worker, I mean all those roles that have similar titles. So community support worker, mental health support worker, care support worker. So all the different titles. But yes, you can answer into those. Okay, thank you. I think what we'll do now is we'll just quickly go into, it's just a video, which is just literally a couple of minutes. So we'll just go into that if that's ready. Stefano, I haven't got any sound at the moment. There's still no sound. I wonder whether it's that you're muted, Stefano. Here we go.
Healthcare support workers are vital members of the nursing workforce. They carry out a variety of roles in our departments and clinical areas, supporting the nursing team to deliver hands-on patient care.
Their patient care day to day, we wouldn't manage without them.
Growing up, I always loved the idea of being a midwife, and I knew I wanted to work in a hospital. A midwife that I knew recommended that I do the maternity support programme, but first do the healthcare support programme. So I started doing that and I loved it. I like the face-to-face sort of really the patient care. helping people sort of when you're getting up in the morning and just being there, bit of support throughout the day, especially within COVID when people couldn't be with their families. I quite like being that sort of person that can help them out for the day and give them a little bit of comfort.
I think Maidstone and Tunbridge Wells is a really supportive work environment. As a management team, we're very forward-facing and approachable. There's lots of opportunities for development and it feels like a real family.
You don't have to have worked in healthcare before, or in fact the NHS before. We welcome candidates that are new to care and new to the NHS. You might want to become a nurse one day, or before that there's a nurse associate programme. So there's apprenticeships that we can offer that can really project your career to wherever you want it to be.
The Level 2 Healthcare Support Worker Apprenticeship is an excellent pathway for individuals who are new to care. There's lots of support there for the first 13 months of your employment into the NHS. It also provides you with Maths and English qualifications and the Level 2 diploma qualification, which is they're all accredited, and they're lifelong qualifications that you can take onwards and upwards into your healthcare career.
So I've recently been accepted for the Registered Nurse Degree Apprenticeship programme. So that will be my plan for going forward, and hopefully that will be starting in September.
We've done a lot of work in the trust to ensure that progression is there. They can come in at that entry level, and then there are many options moving forward, going into sort of senior roles where there's specialisms attached. We have like nursing associate programs, and they can go up to registered nurse and even advanced clinical practice. So there's a clear pathway that they can use. Everyone is extremely professional, very dedicated. There's lots of support in place.
There are so many opportunities available now in healthcare to go onwards and upwards.
I started as a healthcare support worker and now I'm a staff nurse.
We're really keen to welcome people from a wide variety of backgrounds to reflect the community we serve. If you have a young family or other commitments or hobbies outside of work, we try to enable flexible working that meets your needs as well as ours.
The environment is lovely and it's just about a 30 minutes drive to London. And I've got family there, so I always travel every weekend to see my family and then back.
Starting with the healthcare programme can really help you see what it's really like to work in a hospital, to look after people, and you might realise that you love it and you might stick with it forever.
Healthcare support workers are vital to our service. We could not run our hospital without them. They're such a valued part of our workforce.
Everyone treats you with respect and kindness. No day's ever the same in here. Loved it, absolutely loved it. The different variety on the different wards, caring, putting patients first. It was a really sense of achievement. If you're new to the role, if you've never done the role before, go for it, take a chance. I never had any medical background before I joined here. Started off obviously as a hospital porter and then loved it, loved the trust. Go for it.
Thank you, that's great. We got there in the end. Lovely technical problems. Now what we'll do is we'll go back to Sarah, and hopefully she won't get kicked out each time she speaks. Over to you, Sarah.
First time's a charm, eh? So again, I'm Sarah and I'm a HCA that works in high dependency in Frimley, and I'm also doing my level 3 apprenticeship, which is due to finish in October, and that's in adult nursing at the moment, which I'm thoroughly enjoying. My role as a sort of all-round is I do personal care, we do dressing wounds, we take blood samples, so venipuncture, we get training and support for that. We're involved in taking observations for patients, so temperature, blood pressure, things like that. We're involved with the physiotherapy, so if that's something that you enjoy or you're looking towards, you know, you'll have a lot of involvement with the physio team. We do wound care and management of that because obviously the nurses are busy doing lots of other things, so things like sometimes we do dressing changes, and just if there's any issues with those wounds we make the nurses aware. And there's just so much more. It's a lot more than just personal care, which sometimes I think people get a little bit misconstrued. As a HCA, it's absolutely a mass of a role of opportunities and just chances to kind of work out what you want to do. So for me, when I was at school, I had no idea what I wanted to do. And since joining the trust now, it's opened up my eyes, and doing my level 3 apprenticeship has really made me realise sort of where I want to go in life. And I've been really fortunate to have those opportunities, which working with the NHS gives you those opportunities as well. You can speak to clinical education teams or even your manager, and they'll encourage you and support you within following the path that you want to go down. I've got quite a lot of years of experience. I've done about 13 years of care, and that's all different sort of sectors, which has obviously made me, coming into the hospital role was a lot easier in the sense that I had a lot of the care background, but that's not something that you can't learn, because there's lots of support here from the nurses, and obviously you'll have time where you're not in figures, so you'll be supported by another member of staff while you transition into the role, which is great. So it's not as scary as it needs to be. I chose acute care for me because I've done many years of working in care. I wanted a bit of a challenge, and I certainly got that in acute care, that's for sure. So also the reason why I still am in this role and I still go back is, for me, it's making a difference in people's lives. So thankfully the video that you've just seen really sort of showed a lot. It's making a difference to someone else's day, seeing that person get better, stepping back down to a ward or going home, seeing them getting up on their feet and walking again after a major surgery. Obviously, unfortunately, you're there to hold somebody's hand at maybe the end of life, but seeing that person be out of pain and be relaxed, and supporting the family and making those situations as good as possible is a really rewarding feeling. So it's kind of like you've just got endless opportunities. I've been fortunate recently to attend an apprenticeship meeting, and through that I realized just how many opportunities there are now. I didn't think I realized how much there are. Apprenticeships go up to such a high level, and you can work from a level 2 and work your way up into nursing. You can go into being a radiographer, it's just endless. With physio team as well, which is a great opportunity. There's different technical levels that you can get into. So if you're not sure what you want to do, get in touch with them, because you might realise there's actually an opportunity within that you would really like to get involved in. So yeah, if there's any questions at all. I don't know if we've read any on there.
I can't see at the moment, Sarah, if there's any particular ones, but we can come back to you if anybody comes back with ones from you. Have you got one? I think
there's one. Well, there's one hand up. Forgive my pronunciation. Is it Manav?
It is. Thank you.
Go for it, Manav.
Yeah, thank you. So for non-clinical roles, being an international aspirant applicant, will it be a healthcare worker visa, or will it be a tier 2 visa, please?
When we can't give exact advice on visas, because we're just doing for the Southeast region support workers at the moment, Manny. At the moment, though, for the NHS, they're not giving visas for support worker roles, so it would have to be something else that you would look at. Okay.
I see. Sure. Thank you.
Thank you. Now we'll go over to Catherine for her slides.
Lovely, thank you. Thanks everybody as well for joining. There's so many of you, which is really lovely to see so many people interested in being a healthcare assistant or a healthcare support worker. So excellent. Right, lovely. So, I can actually move these slides myself. Brilliant, thank you. So can everyone hear me okay? Because I think I've frozen on the screen. No, all good.
Yeah.
Okay, so just have a little bit of a session on healthcare support worker development opportunities. Sarah actually did a really good job of going through all of the opportunities, which was brilliant. But just moving on from really what Sarah's just said. So these are a few quotes from the people that work within the NHS, within our trust here. As you can see, making a difference in people's lives, proud to work in the NHS, no 2 days are ever the same, and learning something new every day. So when we're thinking about learning something new every day, as a healthcare support worker, you will have access to training and learn all of the basic nursing skills. So these are some of the fundamentals of care that you'll receive, your sort of basic nursing training skills that you receive your training for. But obviously it depends on the setting and where you work. So this is just more of an example more than anything. So if you can see all of those there, there's a huge amount of different things that you'll learn whilst being a healthcare support worker. These are some of the clinical skills as well, which obviously you'll receive all of the training for those, and you can really professionally develop your own skills. So this isn't an unlimited list, this is just an overview for you to have a little look at the sort of things that you'll be learning along the way. So when we're thinking about development opportunities, you will also work towards gaining qualifications. So these could be the care certificate, and also opportunities to learn those new clinical skills and access to study days to learn and professionally develop yourself. You could also achieve your functional skills, or you could apply for an apprenticeship, which you will hear a little bit more about that after me with Nikki. Okay, so as a healthcare support worker, you'll work across a variety of different settings. So as Neil said earlier, anything from mental health to children's services. So under the supervision of a healthcare professional, you'll be supporting them and helping the patients on their journey to full health. You could even specialise in a particular setting or train to qualify as a healthcare professional. So when we're thinking about training towards qualifying as a healthcare professional, there are so many different options that you can take. So there's different career pathways depending on your goals. This is just one example. So this example here is kind of a typical career pathway for somebody who would be a healthcare support worker coming in into the NHS that decided that they wanted to just go a bit further and really branch out, maybe to be a nurse, a registered nurse. So at the bottom of the pyramid there, you've got the red colours.
Catherine, sorry
Yeah.
to cut in, but it looks like people aren't seeing the slides advance. What slide are you on? And I'll move them forward for you, because I don't know if we're catching up with you.
Okay, so we are on slide 7. It's the career at a glance.
Okay, I'm going to just go through them slowly because we got stuck on slide 2. So if you just tell me which slide you want to, when you want to advance, I'll do that for you. So we're now on slide 7 and we're seeing your pyramid.
Yep, lovely. So you're on the pyramid there. So this is your career at a glance here. So having a look, this is just a typical pathway. So this might not suit you. This might not be where you want to go. You might have your own ideas of where you want to be in the future. But this is a typical, if you wanted to, for example, follow the nursing route. So at the base of the pyramid there, you've got the healthcare support worker. So that would be a band 2, and within that you have your development opportunities and apprenticeships, which obviously the apprenticeship side Nikki's going to speak to you about in a moment. But you could decide from here, if you wanted to, that you would decide to choose a nursing associate foundation degree apprenticeship. Okay, and then once you've completed that, you would then become a registered nursing associate. So within that role, you would be working alongside registered nurses, and you'd be looking after your own patients and managing their care. So at that point, you may then decide that you might want to become a fully fledged nurse. So you could then decide to apply for a registered nurse degree apprenticeship. And with that registered nurse degree apprenticeship, you would then become, once completed, a qualified registered nurse. So at the top there of the pyramid, you can see it doesn't actually stop there. So you can keep going. Your world's kind of like your oyster. You can carry on going in whichever direction you want to go in. So there's lots of opportunities there for your own career. This is just an example of one of them. But many of our healthcare support workers actually wish to stay in the role that they're doing. They enjoy being a healthcare support worker and just enjoying the development opportunities that you have got within that particular role. So no matter which area you choose, being a healthcare support worker is a role that's at the heart of healthcare. So you need to obviously be kind and caring and willing to get stuck into the role. And it's within an environment where teamwork, communication and organisational skills are vital. But as you can see, the opportunities are really endless. Has anybody got any questions? Looks like there's quite a few coming up in the chat box, quite a few. Did you want me to answer those now?
Yeah, Catherine, if you've pulled any out in particular, or if not, we can. I know there's some apprenticeship ones there, which I can save for Nicola.
Yeah. There's quite a few.
Catherine, can I just quickly chip in? So I know there's been a few around ages, you know, am I too young? I think, you know, can we just cover off where we've kind of developed, in your experience, people that are just entering, maybe leaving school, and that may feed then into some of the discussions that Nikki's going to kind of go into, you know, into the apprenticeship side.
Yep, so you're obviously never too young. Well, saying that, you obviously would need to be of age to come and work with us. But you're never too young and you're never too old either. So both of those spectrums, any age would be vital to the NHS, and you would enjoy any age as well. So coming in, you could come in through a work experience, or you could come in through college, or you could come in without any of those. You could just come in very, very young, and you could start off on a level 2 apprenticeship straight away. So you'd be automatically enrolled onto a level 2 apprenticeship, and you would start your career straight away the moment you walk in the door. So yeah, so there's no age limit with that at all, coming in straight away. And even if you're old as well, you could come in and start on a level 2 apprenticeship, and you can go all the way up no matter how old you are.
And Catherine, old, what's old? So I think just on the back of that, the pandemic certainly gave an amazing opportunity. So where there was something very, very negative in everyone's life, it gave a real development and career opportunity for many in changing careers and coming into a new career. So certainly through the pandemic, I interviewed car mechanics, people that worked in the air industry. We had come and work for us in these roles. So, you know, depending on where you are at the moment and you're listening in, if you're in a totally different career, you know, that shouldn't block you. Still consider healthcare. And as Catherine said, you know, you'll be developed, you'll be supported. And that kind of leads nicely into the apprenticeship side, really, that I know Nikki's going to go on to in a bit.
We've just got Jessica with her hand up. Should we just do Jessica and then we'll go into Nicola?
Hello, sorry, my chat isn't working. I've just got a quick question.
Sure.
So I'm thinking about either becoming a paediatric nurse or a midwife. I will be going into college this year, and the courses that I picked are applied science and health and social care. Do you think that there will be good courses to go into that field of work, or do I need to change them for a different course?
Like coming on that one.
I think it sounds like good good course. Yeah, go ahead, Nikki.
Okay, so I think the two courses that you've picked are good and they're relevant. There's also the option of a T level. So if your college is offering T levels, so there's the health and science T level, and then with that you've got your route, which would be your health, and in there you've got occupational specialisms. So potentially you could be looking at supporting the adult nursing pathway, or you've got your midwifery pathway. There's lots of different occupational specialisms under there. So you've got a few options that you could be looking at.
Okay, thank you so much.
Thanks, that's great. Should we go into you then, Nicola?
Perfect. Thank you. So I'm not going to be showing my presentation. Someone's doing that for me, so that's one less technical hiccup for me. And just to say thank you. I feel that everyone's contributed about apprenticeships already, so I feel like you've taken my limelight. But anyway, so my name's Nikki Morgan. I'm the Learning and Development Manager for Frimley Health, and with that I lead on apprenticeships here as well. So can I go on to the next slide, please? And what I'm going to try and do is I've quickly scanned some of the questions that are coming through, so hopefully I will try and pick those up as I go through, but please ask questions at the end as well. So what is an apprenticeship really? So essentially it's the work-based training programme designed to help employers, so the NHS, train and develop people for specific job roles, and it's also an opportunity for people as yourselves to develop the knowledge, skills and behaviours specific to the role that you're doing, and also about gaining a nationally recognised qualification. So you may have heard the phrase earn as you learn. That's something that is really bantered around, and this simply means that you as the apprentice will be employed and you're earning a salary whilst undertaking the learning associated with the apprenticeship programme. And so age has come up quite a lot in the chats. So to do an apprenticeship, you have to be a minimum of 16 years old, and there is no upper age limits. And I've seen in there that some people are saying it's 18. Organisations work differently. I know within mental health organisations, sometimes there is a limit on there and it is 18. But just to let you know, we've got a new starter coming in 2 weeks' time who's 17, and they'll be going on to an apprenticeship programme, and they're going to be going into a healthcare support worker role as well. But again, there is no upper age limit. We've also got different levels for apprenticeships. So they're available from level 2, which is your intermediate level, which is your equivalent to GCSEs, and going all the way up to a master's level, which is your level 7. So apprenticeships offer numerous benefits, and that's both for the employer and the apprentice. So they really help develop a skilled and motivated workforce. Employers can recruit from their local communities, which really helps diversify the workforce as well. And for the apprentice, it also offers career progression, nationally recognised qualifications, no debts, because you're earning while you're learning. So if you're wanting to go on to those professional registration programs such as your nursing, you can do that through an apprenticeship program without getting that university debt. Next slide, please. Okay, so what does it actually look like? So if you were coming into the organisation, so as a care assistant, you start in an organisation, so whether that's Frimley or another NHS trust. So depending on your prior qualifications, you would step onto the healthcare support worker apprenticeship, which is your level 2 apprenticeship. Now, to complete an apprenticeship, you can't complete one in less than 12 months. So your level 2 is realistically going to take you between 12 to 15 months. And that can really depend on your own learning. Some people take a little bit longer, some people are a little bit quicker. So it really depends. And that's about you gaining those knowledge, those skills and the behaviours that are associated with the apprenticeship themselves. So once you've done that, you've completed the programme, you gain a nationally recognised qualification. Okay, so then that gives you an opportunity to either stay in that role, you know, because we've heard about, you know, some people want to be in that hands-on role, giving that hands-on care to people. Some people want to go a different routes, etc. But it's an opportunity to think about, you know, stepping onto the senior healthcare support worker, or potentially the nursing associate, the assistant practitioner. But also it's about, you know, some people will use the band 2 to come in, dip their toes, see what it's actually like within the NHS. What is it like to work clinically? And it's really about testing those waters, and, you know, and it's about moving into different areas if that's what you want to do. So it's really about developing our own workforce, our future talent pipeline. You know, potentially you could come in as a band 2 and be our future nurses. And one thing that is good to know, so all apprenticeship programs are funded through something called an apprenticeship levy. So that means that the organisations pay for those apprenticeship programs, so there's no training costs that are associated to yourself. Okay, next slide, please. Okay, so this is just another view, but linked more to the actual band of the role. So a healthcare support worker, so level 2 apprenticeship, you're offered the band 2 healthcare assistant role, and you come in, so where it's got that arrow pointing, that's the healthcare assistant, so that's your band 2 role. You'll then do your apprenticeship programme, so 12 to 15 months, which is what I mentioned earlier, and you gain your qualification. And then what you'll see on the screen is that the next circle is your band 3. So that's your senior healthcare assistant role. And then you've got other roles that you can move into. So your nursing associate, your assistant practitioner. Now they're all aligned to apprenticeship pathways as well. But what you'll see on the screen is I've said that you need to achieve level 1 in English and maths for your the level 2 apprenticeships, where it becomes a bit confusing. So if you have achieved your GCSE maths and English at school, so a grade C or above, then you become exempt from doing that on an apprenticeship programme. If you haven't, then don't worry. It's, you know, you can still get into a band 2 role. It just means that you'll need a little bit of support to get to that level of maths and English. So you can either do that as a standalone programme, and we call that functional skills, or it will be included as part of your apprenticeship programme. And then you just need to achieve level 1 if you're doing the level 2 apprenticeship programme. So that's not quite a grade C or grade 4 if you're at school or college now. Okay, next slide, please. Okay, so what I wanted to show you just on the next 2 to 3 slides is different apprenticeship pathways. So these are just a few different ones. So I've got a nursing, I've got a midwifery, and I've got an allied health professions. So this is all about supporting career progression. But it's also showing you the starting point. So the grey circle, I know it's not very clear on the screen at the minute, but the grey circle is the level 2 apprenticeship programme. So that is the healthcare support worker, and it is the same on all of the pathways for nursing, midwifery and allied health professions. This does not dictate your career path, you know, moving forward. So I know someone mentioned in the chat earlier about if they started somewhere, does that mean they have to stay there, or can they move around? Yes, you can move around. So for some organisations, they'll have rotational apprenticeship programmes. You'll still do that same apprenticeship programme, but once you've done that, like I said earlier, it's about dipping your toes in the water. Is that because once you step into the NHS, you will start to see all these different roles, you know, and all these different areas that you can work in. We have over 350 different roles, and it's an eye-opener once you get in there. And actually, you might think, actually, I wouldn't mind doing that. There'll be an apprentice. I can guarantee you there'll be an apprenticeship for anything that you go into, and we can support you through that. But also with these programs, it's just to say that career progression, so this pathway is not linear, and that means that you don't have to do the level 2, then the level 3, then the level 4. You can really step in and step off at any point, and that's really depending on your career goals and your experience. Okay, so if you just go on to the next slide, please. So this shows the midwifery pathway. So if you're looking to go into maternity, so you'll see that grey circle, the first one, that is that healthcare support worker apprenticeship. But what's different about the maternity and also the allied health professional one, which I'll show you after, is that the level 2, the level 3, they are contextualized. So there's elements in there that are linked to maternity and allied health professions. Next slide, please. Okay, so this is the allied health professions, and so within there's 14 different professions just alone in the AHP workforce. And again, you'll see that you've got the grey circle that shows the healthcare support worker there. And then that's it from me. I know there's lots of questions about apprenticeships, and I am happy for Neil, Annette, if you've picked any out that I haven't covered, then happy for you to ask away.
So the themes I was getting, Nicola, was sort of how you progress into an apprenticeship.
Okay.
Yeah.
So when you start within an organisation, so if you're new to care, you don't necessarily have to have qualifications to step in, because we all start somewhere, and you're going to be working with people that have got experience, have got qualifications, and you will step onto an apprenticeship programme. So what I just mentioned earlier is that we've got someone who's 17 that's starting within the organisation in 2 weeks' time. He will step onto that apprenticeship programme as soon as he comes into the organisation. So that's down to me and my department to upload people, onboard them onto those apprenticeship programmes. Once you've done your apprenticeship programme, and another thing to think about, actually, if you're going to other organisations and they haven't spoken about apprenticeships in the advert or at interview, why not mention it? Because it shows that you're keen to progress, that you're keen to develop yourself and in your role that you're doing. So it's always worth mentioning at an interview about that you're interested in gaining those qualifications because you haven't got them.
Nikki, can you recap, because I'm busily trying to answer as many in the chat box as possible. Can you just do a quick recap end to end? I'm a healthcare support worker. I'm just about to enter care, but actually my future career aspiration is going to be wanting to be a registered nurse. Can you just recap on the timelines? I've tried to explain it in the chat, but I think if you verbalise it, it made it a bit easier.
Okay, can we go back to my presentation, probably 4 slides from the end? It was the nursing pathway, and I'll go from that one there.
And also, Nikki, I've tried to explain the salary that you'd usually be on if you was coming into a healthcare support worker role, and then as you develop on, that may slightly change depending on the route you go.
Yeah, okay. Right, so on this slide here, this grey circle is the healthcare support worker level 2 apprenticeship programme. So this is what you would do if you are new to care and you have no qualifications, okay? So when you step onto this programme, it will take normally between about 12 to 15 months to complete that programme. And you can't complete an apprenticeship in less than 12 months, okay? So because we are bound by something called the funding rules. So I would probably say give yourselves 18 months to be on the safe side, because you never know, you may be sick, you may have to take a break in learning, etc. But that's your maximum that it's going to take, is 18 months. So when I say it's not linear, so that means that you don't have to do the level 2 and then the level 3, then the level 5 to get onto the level 6, which is your registered nurse. So what you could do is do your level 2 and then after a little while is you could apply, depending on your experience, you know, how you're getting on, you know, what your aspirations are, I suppose, as well, is you could miss out this one and you could step onto something called the nursing associate or the assistant practitioner programme. So they are level 5 apprenticeship programmes. Okay, so that's a little, so you're working at a level which is senior to a healthcare support worker, but not quite as your registered nurse level here. So you could go from here to here, or if you're coming into an organisation and you've done maybe health and social care at college, or you've come from, I don't know, another care organisation, you're probably not going to start here. You're going to start on this level 3. So your level 3 is going to take about 18 months to complete. So this is your senior healthcare support worker, and that's a level 3 program. So as such, it's senior. So it is indicating that you have got experience in that care field. You've done your care certificate as well. So that is a must to actually step onto this program here. And again, from this, you could literally step onto the registered nurse as well. So it doesn't mean you have to go from one to the other. So potentially, if you're starting brand new to care and you wanted to be a registered nurse, you could do it in about probably 4 years to get onto the registered nurse degree. And so once you're onto the registered nurse degree, then, you know, again, you're gaining that same qualification as anyone that is going to university. The only thing that is different is that you're employed by the organisation and you're earning a wage while you're getting that qualification. You're still doing placements as any other student nurse would be doing if they were going a direct entry route. Does that answer your question, Neil?
Yeah, no. I think it was just bringing to life what I was trying to busily put on the chat. So thanks,
Okay.
Nikki. And I think what you've summarised there is you know, the avoidance, what I tried to put in the chat, the avoidance in racking up your own personal debt going to university, should that be a pathway that you want to do. It's an excellent way of an employer investing in your development whilst you learn.
Thank you. I think looking at the time, we've run over a little bit, so we'll skip the last video. Neil, should we go over to you for a sort of summarising, pulling it all together, and then I'll put up the slides for the contacts.
Thanks, Anna. So hopefully that's given many of you on the call, either via the chat, questions, or some of the presentations, a bit of an overview of what a healthcare support worker role is. Once again, it's an amazing job. It is a tough job, okay, but it's an amazing job, and it's one that you won't regret if this is your first career step into healthcare, be that in the NHS, be that acute, community, mental health, learning disabilities, maternity, and anyone else that I've forgotten who has a healthcare support worker role. So please look, consider a role in any of the employers that are supporting this webinar and any other employer within the NHS that's closer to where you live, and you will have an amazing time. A real career is ahead of you. So please consider any of the healthcare support worker roles. We're all here to support you. Any questions, then please contact. And back to Annette, who will share the details how to move your next career step forward.
Thank you, Neil, and thank you to all the speakers today. That was really great. Apologies for a few technical issues there, but we got through, which is fantastic. And thank you all of you for joining us. And I hope that's given you an insight into how to become a healthcare support worker in the southeast of England. So what I've got here is 2 slides with all the contact details of the trusts that are in the southeast of England. So Buckinghamshire, Berkshire, Frimley, Sussex, Surrey, Hampshire, the Isle of Wight, Kent and Medway and Oxford. So all those areas. These are obviously being recorded, and I'm hoping that what we'll do is get this recording onto YouTube later this week. Now, just going on to this second slide here with some of the other contact details. At the bottom here, you've got an email address, england@SE, which is Southeast Bringback Staff at nhs.net. If any of you have got any particular questions or want these contact details, well, if you don't manage to write them down, then you can email us and we'll put you in contact with the trust that you desire. But you do need to tell us which geographical area it is and which trusts are local to you that you'd be interested in finding out. So all the areas will have different trusts in there. You will have the acute hospital trust, you'll have the community trust, and also mental health trusts, which may be the same as the community ones. So look at your local area, find out which one it is you want to contact, and we can put you in contact with them about becoming a candidate to be recruited. And I'll just flick back to the other one in case you needed that. So I'll just flip through these for a couple of minutes in case people want to take them down. And other than that, we'll bring it to an end. And thank you once again. And do keep being interested in support workers. There's lots of information out there on the websites. If you go to the individual trusts websites, you'll find about recruitment there. Also on NHS jobs, but also if you look on NHS England or Health Education England websites, you'll find more information there. So thank you very much, everybody, and goodbye.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you. Thank you very much.
Thank
Good
you.
evening.
Thanks, everybody.